Hello again, I'm Joel Barthelemy. I've mentioned in a previous video blog that our average life expectancy continues to increase. According to the Organization for Economic Cooperation and Development, American men can now expect to live until almost 80, women to 81. Unfortunately, how we live when we're younger often determines our health and quality of life when we're older. Unless we're able to live with our children, a lot of us may end up in some kind of assisted care living center or nursing home. That means we'll have to rely on unrelated caregivers to look out for our health care. And physicians are not normally present 24/7 in nursing homes. So what often happens is that residents who become ill make an expensive ambulance trip to the hospital. Sometimes the trips are necessary, but many times patients are released within 24 hours. A new study detailed in Health Policy Newsletter, Health Affairs, sheds light on whether telemedicine could be useful when a doctor was unavailable to a nursing home to decide if an elderly resident needs hospitalization. This controlled study, reported in Forbes magazine, focused on 11 nursing homes in Massachusetts that were able to connect their residents with physicians via real-time video conferencing. Staff at the facility consulted a doctor when a resident was ill to determine if a trip to the hospital was necessary. Why use video conferencing? A physician needs to talk and see a patient as well as the nurse at the home to make a proper evaluation. In case you think this was a setup, that the nursing homes involved were for more well-to-do residents, the researchers specifically chose facilities with lower quality ratings, more beds, and fewer staff than the average in Massachusetts. And get this, the study showed that the average savings for a nursing home with Medicare residents was $151,000 per year, and the annual cost of the telemedicine service was just $30,000. So the net savings would be roughly $120,000 per nursing home per year. Yes, a nursing home must make an initial investment in connected health solutions, and certainly the nursing home staff needs training in how to use the equipment. But think of the advantages. Residents are seen in a timely manner when they become ill. They can stay where they are comfortable if the physician determines going to the hospital is unnecessary. Keep in mind that Medicare doesn't bear the cost of an unnecessary ambulance trip. When the trip is unnecessary, we all pay for it, whether it's Medicaid or Medicare footing the bill. And the hospital doesn't lose Medicare money for a readmission within 30 days of an earlier stay. Forbes contributor Carolyn Rosenblatt, a former nurse who wrote the story about the study, concludes that video conferencing seems to be an excellent change from how things have traditionally been done at nursing homes. Nurses now have better access to physicians, and patients too. In fact, Rosenblatt says she remembers her frustration at trying to reach a physician by phone at night or on a weekend and having an on-call physician who doesn't know the resident send him or her to the emergency room just to be safe. You know, many of us have elderly parents in another state. Sadly, we often hear of their medical problems after the fact and have no control over important healthcare decisions that are made in our absence. I agree with what Carolyn Rosenblatt says, that telemedicine can bring the physician to the nursing home resident more often, more easily, and cost-effectively. Have a story about telemedicine in a nursing home worth sharing? Tell me about it. My email is simply joelsblog@globalmed.com. That's JOELS blog@globalmed.com. I'm Joel Barthelemy.